Well, maybe this, your question may be answered by referring to the other papers or the other presentations that were made. First of all, two of them concerning the longer-term follow-up of different types of initial treatment for the initial chemoimmunotherapy for advanced follicular lymphoma. And data were presented which allowed you, and further discussion was undertaken with the audience to try and decide whether R-CHOP is actually the best treatment to give in the first instance. I think the conclusion was that it was either R-CHOP or R-bendamustine, based on the data in the presentations and also data that came out of the ASCO meeting. There were repeated comments, however, that although the progression-free survival curves may be stronger with R-benda and R-CHOP, the overall survival patterns with either treatment are not necessarily different. And there was a discussion following on from that about whether the comparator should include R chemotherapy and maintenance therapy. And there were two presentations, about the role of maintenance Rituximab, one following high-dose therapy and one following conventional chemotherapy. We are still awaiting overall survival data in this setting. And the last paper was an important descriptive study from two large groups about the patterns of survival and the causes of death for people treated for Hodgkin's, for follicular lymphoma. So to come to what you asked me just now, there is an unmet need to determine whether or not maintenance Rituximab is wise after bendamustine Rituximab, and what survival advantage it gives after R-CHOP. There will be a discussion about which is the best antibody to be combined with chemotherapy, and all of this demands well-conducted clinical trials and observational studies. Against this background, after a period of time when there has been a considerable improvement in the outcome of follicular lymphoma overall, there is an exciting new issue of determining whether the new types of treatment that we have with specific targets will influence the outcome of follicular lymphoma, and at which point, if any, they should be introduced. And as a last point on that, there is a question about what the endpoints of such studies should be.